How to explain medical topics like you're not a nerd. I want to talk about pericardial effusions. And there are two more common scenarios. In the extremes, it's easy. If they have a crazy amount of fluid, they're in tamponade, you need to call interventional cardiology, you need to call cardiothoracic surgery. They go get their procedure, they get the fluid out emergently, but that's a patient who looks bad. And for most people, that's easy, but a lot of the problem is explaining these things to the patients in the middle. One scenario is an older patient with renal disease, with cancer, who likely has had fluid slowly accumulating over a long period of time. And for those patients, if I'm doing an echo because I'm looking for volume status, I'm looking for ejection fraction, how well is the heart working, and incidentally I find a moderate pericardial effusion, you say that to the patient. You don't withhold that from them. And sometimes they'll say, fluid around the heart. I'm not supposed to have fluid there. That's a scary thing, which is fair. And to them, I usually say, I hear you, but it's not impeding your heart's ability to do the job. We look at the blood pressure. We look at how the heart is squeezing. We look at how the heart is filling, because that's the thing with tamponade. You get diastolic collapse instead of filling. If you don't have that and you're not in tamponade, you can reassure the patient that way. I have yet to see a patient that is encouraged by, oh, well, it's only like a half a centimeter. It's only a 1 centimeter pericardial effusion. They have no idea the importance of that. And this scenario done a different way, a 0.5 centimeter or a 1 centimeter pericardial effusion in a 20 or 30-year-old with post-viral pericarditis or something could be very significant to them. So this same scenario in a different way, if there's a patient who looks bad and they have a large effusion and you're assuming by their history and physical that it's a new thing, you can use that to kind of impart your concern for that patient. Because a lot of these cases in the middle, not all pericardial effusions require a procedure, but not all pericardial effusions that do not require a procedure require zero follow-up. And it's your job to be able to explain that in a way that the patient understands without jargon and not so much like a nerd.